Hi, this is Dr. Stephen Bracci, Verve Medical Cosmetics. There was a recent article in the New York Times that shed light on dark circles under the eyes, highlighting various causes and treatments, but there's more to the story, and there's more that meets the eye. According to the article, dark circles are certainly challenging to treat due to their various causes and hues. While we may have over-the-counter creams, and there's certainly the aging process that involves thinning of the skin and loss of collagen, are all mentioned, there's a critical aspect that needs more focus. And the truth is, the appearance of dark circles under the eye isn't just about skin changes. It's about architectural changes beneath the skin, namely the loss of supportive structures, muscle, bone, and fat. These structural losses create hollows, often making the under eye area darker and more pronounced, similar to the changes we see in our hands as we age. We lose supportive structures in our hand and we are able to see the veins and the arteries and the ligaments more so because there's atrophy. And the same thing goes on under the eye. So I agree with this article in principle, and it's clear that topical skincare creams offer very limited benefits. While they may hydrate the skin and temporarily plump the under eye area, they don't address this underlying issue of structural support loss. So likewise, treating just the skin itself with things like laser and chemical peels or microneedling may make the skin appear slightly improved, but they will not appreciably affect the creases and the loss of support that is often the main component of eye bags. Often the darkness under the eye goes way beyond just a pure skin condition. So what can be done? Well, there's two main avenues of treatments for under eye bags, which is the most common cause of dark circles under the eyes. First is the surgical intervention like blepharoplasty, which cuts and repositions tissues, or the non-surgical option like under eye fillers. My under eye procedure is called iRise. While surgical effects are permanent, they come with trade-offs. The altered look may look different because the skin and the tissues have been shifted and not age well because the skin has been manipulated and there's a loss of vasculature. So the surgical issues can become more apparent over time, and obviously it becomes more evident that somebody had surgery. On the other hand, under eye fillers, particularly the techniques that I developed, the under eye procedure, iRise, provides lifting and support, but flexibility. So they allow for adjustments over time, adapting to the natural aging process without altering the underlying appearance drastically. Moreover, fillers work under the eye area with the principle of reproducing the structural support under the skin, so the skin is lifted and elevated and repositioned to its natural resting architectural position. In conclusion, while dark circles can be a difficult problem, understanding the root causes and available treatments is key. Whether you choose a surgical option or a non-surgical method such as the iRise, it's essential to consider the long-term effects, how they align with your aesthetic goals, and certainly align with how you want to age long-term. So for those exploring under eye fillers, the iRise method offers a proven and adaptable solution.